Welcome to MYA Confidential. I am your host, Krystina Jones, and I am joined by
Chloe Beresford. I am the CEO here at MYA.
We are here to educate and explain about cosmetic surgery. We're going to dispel myths. We're going to change perceptions. We're here to reassure patients who are embarking on or within their journey with MYA. And we are going to have fun. We're going to be speaking to patients, speaking to listeners, allow them to become part of the MYA brand and community. This is a family-owned company. We're approachable.
And we want you to be part of the MYA family too.
Welcome back. MYA Confidential, guys.
Here we are.
With the originals. No guests today.
I know.
It's just you and I, baby.
No, stuck with just us.
Yay. So
No one
I'm
else.
Krystina, and this is Chloe.
Hello.
You should know us by now.
I'm sure they do. For those of you who are not familiar, I'm the CEO here, and Krystina, you are?
Patient Services Director.
Exactly.
And together we make MYA a fabulous place.
And we chat
with
about
everyone else.
And we chat about cosmetic surgery.
All the time.
Yeah.
Live and breathe it.
Today,
what are we going to talk about today? Yeah.
Oh, yeah. Well, today I would like to talk about procedures that don't get talked about enough.
Love that.
So,
like a little taboo.
Yeah, definitely. Today is all the things that people don't really want to say that they're having done because it can be they're embarrassed. I just think there's certain things. It's a bit like menopause. I've noticed a lot of women say that at the moment, how there's not enough people talking about menopause.
Yeah.
And maybe there are these subjects and certain areas of a woman's body that we don't talk about enough.
Yeah. And let's do it now then. What are we going to kick off with?
We're going to talk about labiaplasties.
Love a labiaplasty.
Exactly. It's an amazing procedure to have.
Yes.
And sometimes it's one of those procedures where, it can be something that you're born with what you're born with.
Yep.
It's not like anything you can go to the gym and you can make it smaller or there's nothing really you can do with your labia. It is how it is.
Yep.
Sometimes this can have bothered you for years and years and you've maybe just thought, oh, there's nothing really that I can do about it. It's just how I am. You may be a little bit embarrassed, but you deal with what you've got. But what I have noticed is how amazing the results are for labiaplasties and
100%.
How much confidence that gives a woman, especially when they're
intimate.
And
no one would know it.
Well, yeah.
Until it's at that
unless
point.
you were to disclose it.
Yeah.
But I mean, you could just pass it off as your own.
Yeah.
Because why not?
Exactly.
You don't have to go around shouting about it.
It's definitely one of those procedures that no one needs to know about, isn't it? Like if you don't want to tell anyone, you don't have to. Yeah. And I think it's quite an interesting procedure as well because patients could have, like you said, been born with it, or it could happen post babies.
Yeah.
It can be any kind of variation and it can be excess skin. It could be a variation in asymmetry.
Yeah.
And it's not just, which I think everyone goes to, like a pure sexual gratification side or just it being, oh, I want to look like a porn star. It's not that at all. It can be chafing for running and, you know, something on your lingerie that you get that friction.
Or when clothes like go up there a little bit much and it looks a bit, people
Camely.
say. No, but it is sometimes when people, they sort of suffer in silence because they think, oh, this isn't very nice. Or they may feel like, they don't want to get undressed.
Yeah.
In an environment, say, where they're maybe amongst friends, maybe they're at the gym, I don't know, maybe they're with their partner, but they just feel really self-conscious because, often what can happen when there is excess skin on the labia is obviously it does hang down and it does sort of sit there between the legs.
Yeah.
And it doesn't, for some people, it doesn't look how they want it to look.
Yeah.
And you can get something that's a lot neater.
Yeah. More comfortable.
And that a lot of people feel is a nicer image.
Yeah.
I mean, I don't know whether it is or it isn't. Who knows, really? I suppose that's a personal
It
choice,
literally is
isn't
that.
it?
It's for every single person, their unique, what they want post-operatively, and how that feels for them as well, isn't it?
Exactly. It's like with breasts, some people just would never have a breast augmentation because they feel that they would not want to do that to their body for whatever reasons. It's always cosmetic surgery, like I always say, it's totally personal choice. Nobody can judge you. You don't have to tell anyone you're having it. You don't have to justify it. It's just something for you.
100%. And with this procedure too, it's so nice and easy. It's such an easy process for the actual procedure. And actually, I think when starting for MYA and learning about the labia procedure, who knew that there was so much to one small little area that you can have done? Because you've got the minora, the majora, the clitoral hood. Hopefully,
which I'm a bit confused about. What's the minora? Is the minora the outer part?
The minora is the lip.
Oh, the
majora
inner
is then the connector, so to speak. And then you have the clitoral hood at the top, which then covers the clitoris as well.
Right. And that's when you can have the hoodectomy as well, can't you?
Yeah.
Which makes that as neat as the rest then. So it's all
nice and tidy. Like a little flower.
Yeah. Because you know what? After a natural birth as well, things don't always look the same down there.
Yeah. It can be something that you can become quite self-conscious about, especially with partners. And just not feeling comfortable in that area, even with clothes, which we get a lot, especially if you go into the gym and you've got those tight trousers on.
Oh, I know.
Or even just wearing a bikini or swimsuit.
Gym
you become
trousers
more
are like that. They always go right up between your legs, don't they? Those leggings.
Yeah.
And you can feel a bit like, everything's
on show. And the thing is, no one's looking. Like, you assume no one's looking, but you feel it and you feel very conscious of it.
Yeah.
Especially when you're working out and you're in some very bizarre poses anyway. But I would say it's an incredible procedure that just takes about an hour, up to 2 hours if you're doing all 3 areas at once. And that's the other bit. You could do just the hood. You could do just the minora. You could do the minora and the hood.
If you were just having the labia, though, if you're just having the labia reduction, which is just the simple labiaplasty, where I always refer to it a little bit as going to like the hairdressers. I know that sounds really like inappropriate because it's obviously nothing like going to the hairdressers, but in the way of it's a trim.
It's true, though.
It's an area that sometimes after having children, with the pressure of carrying babies, gravity takes its toll. It used to maybe look a little bit more tucked away.
Yeah.
And then over the births and the pregnancies, it has then lowered and become more apparent.
Yeah.
And it's very much there, and it's not kind of quite as neat as it once was. And you can just have that little bit of excess skin sort of trimmed away. And those kind of procedures, they're probably only about 40 minutes, aren't they?
Yeah.
Just that.
Up to an hour maximum. And then if you wanted to include it with something else, you can. And that's the other bit. You could have a labiaplasty and your boobs done if you wanted to.
Yeah. And it's a day case as well. I mean, you can do that in a day. You can be home for your tea, literally. No, but you can. I mean, it's that simple. And I know we do our labiaplasties mainly under general anaesthetic. Which I always say with surgery, I would prefer to be asleep.
Yeah.
But some people, you can have it under local if you wish.
Yeah. It's an option.
It is. So it's just so simple, really, isn't it?
And it's an easy process post-op as well. The whole procedure, like we said, is easy, and it's a nice, easy one to do.
Yeah.
There's nothing really that you have to do massively post-op. You're not having to wear a specific garment or anything like that. It's just unlacy knickers, as granny-ish as possible is the best one.
Cotton briefs.
Yes. You don't feel much pain. It just feels like a kind of achy feeling.
Yeah.
You can sit on some frozen peas if you really want to. Another trick of the trade, if it hurts when you go to the toilet, you can just put some water on there at the same time. That's a good one, actually, for people having post-babies too. It kind of combines. There's some added tips for you guys.
That. I think my baby days are over.
Put a bit of water on, and then that helps when you go to the toilet too. So that's going to be a maximum of about a week. And for, you know, a lot of people at the moment working from home, you
Yeah.
wouldn't really have to take any time off at all. You could literally just sit there at your desk
And no one would even
would know.
No, it's not like maybe when you have, say, a rhinoplasty where it's like very apparent,
Yeah.
oh, you've had surgery. And even your breast to a certain extent. I mean, I suppose it depends. If you're only having a very small implant, some people wouldn't notice. But often with breast surgery, it probably would be apparent, wouldn't it? If
and
it's
you're more
somebody,
restricted, like you can't lift your arms up.
Yeah.
But when it's here,
Yeah.
a bit of like tender walking maybe for a couple of days.
But
and then
no
after that, no
one's going to know.
No one's going to know.
Yeah.
No one's going to know. So that's what I love about that procedure. And it's good when patients come and talk to their patient coordinator about it.
Yeah.
Don't feel like we've never heard it, because we hear it all the time.
Yeah.
And there's so many patients having it day in, day out. It's a normal procedure for people to have.
Yeah.
So don't feel like you're the only person that's ever going to say that.
Yeah.
Not at all. Come on down and talk to us if you want to.
You know, another procedure that I think doesn't overly get spoken about, and again, I don't know whether it's because it's more linked with possibly a woman of a certain age. It's more linked with a procedure that you have when you're starting to show signs of aging, would be having the upper and lower blephs done, or maybe just the upper, which do you want to explain to people watching, listening, watching, whatever they are?
So blephs is the posh name for our like upper eyelids, this skin area here, and then the lower for your underskin here too. Surgeon just does a teeny tiny incision site either around the eye socket here at the top or the lower eye socket there. They can then, this is actually one of the best pieces of advice that a surgeon ever gave me. He said when he was doing the lower blephs, he would literally be like hoiking out old cream from like fatty deposits where people have put the eye cream all along here.
Really?
So everyone, what you need to do is you just use your little finger, you put a little bit of eye cream on here and you put it on your cheekbone, and then your skin will lift up and absorb what it needs to. So that is the MYA trick of the trade.
Really?
And surgeon trick of the trade.
Well, I tend to put my eye cream on. I use that finger actually more than my little finger. And I tend to just dab it, but I would tend to go sort of not as low towards my cheekbone. I would probably go a little bit higher. So I'll have to remember that.
There we go.
One of our managers here, she has had some recently, hasn't she? Tell us about Amanda's surgery.
So Amanda's my work wife, and other than you as well, my darling. And she has had her upper blephs done. And again, she's in like late 30s. I think she's like 36, maybe 37.
Right.
So as an age perspective, you wouldn't think that that's a typical patient to have it done. But she's always just had excess skin to the eye area here. And again, I'd never noticed it. It's something that's always bothered her. Spoke to the surgeon and he said, yep, there's definite skin we can take away. She's had the procedure done. Honestly, her eyes, she's always on the MYA website. Her result just looks incredible. She looks so much brighter. The eyes are wider. Her eye makeup's going on a lot easier. There's none of that creasing afterwards.
She definitely looks fresher.
Yes, 100%.
When I saw her afterwards, I was like, oh. And I hadn't even noticed actually the skin beforehand, how maybe prominent it was, because I just genuinely hadn't noticed.
It just brings like a shadow, doesn't it?
Yeah.
And I think that's what she didn't like. And then in having this done, she just feels so much more confident.
Oh, it is lovely when you make people feel confident again.
Yeah.
And I know with the bleph surgery, there's a lot of places, like a lot of clinics that claim that they're doing the blephs and they're doing it as day cases. I know about a few competitors that are doing it, and they're doing it, you know, what I would say is very cheap for upper and lower. And I always think when it's cheap, you know, why is it that cheap?
That's what always worries me.
Yeah.
Because we know how much everything costs as well and how it all comes together. What are they scrimping on? That's what worries me. And with the procedure, you know, again, it's nice and easy. It's a good hour in theatre and small incision sites. So from a patient perspective, it's easy to heal from, but there's still so much that goes into it as well.
Yeah.
Your anaesthetics, the anaesthetists, your scrub nurses.
I think some places are doing it under local anaesthetic. And I think that's probably what reduces the price a little bit. I personally don't think I would want to have that done under local.
No.
I think I'm always more for just knock me out. I don't want to really.
It's easier with the general anaesthetic because the patients then, you know, then they're not in a normal surgery setting.
Yeah.
You don't know what to expect. And actually then being under general anaesthetic, the surgeon can just do whatever it is that's needed, make those incision sites, take that skin away and sew up all nice and pretty afterwards.
I know. And it takes years off you.
Yeah.
And, you know, it's interesting because there's so many places as well now that are kind of unregulated places doing all these anti-aging type procedures, Botox, filler, which I'm by no means against. I think they're all, you know, I think a lot of places are doing, you know, really good jobs. But unfortunately, there are some places that are doing really, really bad jobs.
100%. And actually even finding a doctor or surgeon that would say no as well, that actually is happy to say, no, I can't do it. I can't reach your expectations.
Yeah.
Or no, I don't think it's suitable for you. You don't actually need it.
Yeah.
And that's powerful rather than someone just going, yeah, okay, I'll take your money. Let's go for it, shall we?
Yeah.
It's getting a very fine line for that.
Yeah.
And that's what I like here with our surgeons. They are honest and they will say what they can physically do to get the patients what they want as well.
Yeah, yeah. And sometimes, you know, I know some patients, it can be a little overwhelming sometimes, can't it? When cause surgeons do have a tendency, I'm sure they won't mind me saying, but sometimes they can be brutally honest with things and they don't always maybe deliver it how a woman would.
Yeah.
A typical man.
They're very black and white, aren't they?
A typical male trait, probably.
Yeah.
But and that's why I suppose with ourselves at MYA, we always have patient coordinators there, nurses and other people around to help patients understand the reasoning behind.
Yeah. Putting it a bit more in layman's terms, I think.
Yeah.
Because the surgeons will do it quite straight speaking, to the point, this. And then when you do then see a patient coordinator afterwards, they can go, okay, I can see why he said that because of this, because of that.
Yeah.
And then it just makes that bigger picture. Makes it a bit more.
Yeah, because I think sometimes you can leave the consultations feeling a little bit like, well, deflated sometimes. You can think that maybe you need one thing and actually you need something else, or sometimes something isn't quite what you thought it was. So it's actually not severe enough to warrant having surgery. Yeah. And then it can be a bit of a difficult place.
Yeah. Okay, so let's now talk about the topic that everyone wants to hear, especially in January after a couple of mince pies.
Or 5. Or 10.
The surgery that I love the most, liposuction, which...
All the wine as well that may have been... Oh, don't.
Well, we won't think about it. But liposuction is such a great procedure. And we have the weight loss offerings that we've got now as well too.
Yes.
And with that, it's like we've just said, whereby a surgeon may say you need X, you've come in for Y. Yeah. And it's then having that whole package that we can go, okay, you might not be suitable for liposuction, but we could look at tummy tucks or gastric bands or whatever else it is that we have that's possible.
There's always a solution, isn't there? I think sometimes it's just finding the appropriate fit for each case. And that's why it is so important to get the right surgeon so that you know that you are actually getting the right procedure.
Yeah. And with us, we've got our liposuction specialist surgeons as well. Yeah. And that I find is the best thing, especially with liposuction, to make sure that you've got a surgeon that's really comfortable and confident doing
Yeah.
it, because it's an intense surgery for the actual surgeon to be doing.
But it's quite physically demanding, so I've heard.
Yeah, like
it's a bit like having a workout.
And
getting rid of all the fat.
Yeah.
Doing all the hard work on the treadmill.
And then, nice svelte patient post-operatively.
Yeah.
But we've got the chin lipo, which I definitely want. And we've got, the liposuction you can have anywhere from practically your chin downwards.
Yeah.
And the fact that with that, you have that full consultation with the surgeon. What areas is it that you're looking to have done? How many hours will that be? And let's get going, basically.
Yeah.
But it could also be during that the surgeon thinks, okay, we've got too much excess skin here. So that's when it's then having to go more so into a tummy tuck procedure.
So it tightens it all as well.
Yeah. Or it could be, I don't think we're at the right BMI currently. Let's look at potentially more the gastric side of it all. Then lose the weight. Then let's see how the skin's like kind of
looking
settled.
At that stage. Yeah.
And then what can we do from there?
Vasa's so amazing as well, because what I find with Vasa is where conventional liposuction, it used to be that, they'd take the fat away. But then obviously, yes, you could be left with some looser skin where the fat obviously once sat behind. Whereas with Vasa, what's amazing is it actually does make you look like you've been to the gym.
Yeah, that
tightening. When you see people, like I am literally so tempted. I think about it so much having Vasa. I think what's hard as well with mothers, I always go on about the fact I've got 3 kids, and it is hard with mothers. It's sometimes finding the time to make 100%. Time for you to do a procedure like that, because obviously that does require a little bit more downtime.
Yeah, you're going to need a good week off at least. It's going to be like you have done the most intense workout ever. And especially when it's around the stomach. It's even when you get your boobs done as well. You don't notice how much you use your upper body to get out of a chair. And you don't notice how much you use your core area to, again, get out of bed or get out of a seat.
Yeah.
And you've got these lovely garments on, which I say with love and joy, which you have to then wear for those 6 weeks. They give you the best result post-operatively, but honestly, during those 6 weeks, you want to rip them off and burn them. But they work. They work 100%. And then actually, the compression garments. And then as it does get to 6 weeks and you are allowed to take them off, I actually felt like I was lost without it. I was like, oh my God, I want it back on. I feel like I don't feel like I'm sutured in anymore. Yeah. But it helps you then kickstart everything. It can be the kickstart then into go into the gym, to making sure that you're maintaining it. Yeah. To then do your workouts and to embrace that body. Again, you've invested in it. Yeah. Take care of it.
Yeah. Yeah. And it's a lot easier than slogging it out in the gym, isn't it?
Oh, yeah. I found that when I'd had the lipo that I did this like ab challenge at the gym once.
Oh, right.
And I was literally dying because I had the abs because I'd had the lipo. And these like people were looking at me like thinking, well, surely she's fit as anything. And I'm like, no, I'm just lying.
Yeah. Well, because it does look like that. I often think that with when you see the Kardashians and things where you can clearly see they've had the Vasa, the contouring, and, it's all very apparent, but they look like they are like seriously working out. I mean, I do think they all exercise, but they almost look like they're exercising 3 times a day.
Yeah.
Because it looks that insane. Good.
Yeah.
It is quite like amazing what these surgeons can do.
I know. They are
I think
incredible.
I need to go book myself in.
But it's a nice kickstart, isn't it? And liposuction, again, is something that people don't necessarily talk about because people might think, oh, you're lazy for getting it done. You're not. And actually being in a really good physical shape beforehand will allow the surgeon to then take more fat out because it's all down to the amount of fat cells that you've got. Those fat cells can get bigger, they can get smaller. But once the surgeon physically removes them, it's not as if you're then suddenly going to get bigger arms or bigger legs. If you put on weight and lose weight, it's the exact same process. But those fat cells that have been removed are never going to come back.
Yeah.
It's the best thing ever.
So on that area, so say you had your tummy.
Yeah.
then you're not really going to be in a position where you're going to get a really big tummy again.
No.
Because those fat cells have been removed.
No stay.
I know. It's so tempting. It's so good. I mean, I know so many people, obviously, here at MYA who have had it done, and the results are incredible.
They are.
If you can check it out on our website, because we've got some really, really good ones on there.
I've noticed as well, when I've been watching the PCs do their econs, they show my pictures from the liposuction as well.
They?
I was like, oh,
I recognise her.
She looks fine.
Oh, well, that's nice. Good.
You can see that it's a real life person as well.
Yeah.
Let's do my favourite segment. Dear Maya. I feel like I need to sing everything now. So this one we haven't actually spoken about a lot during the podcast. And I think it's an amazing procedure that we do. And someone's written in asking about the differences between rhinoplasty, so the differences in nose jobs, so to speak, because there's different approaches, isn't there?
Yeah, God, yeah, absolutely. Well, there's different ways of doing it, isn't there?
And you've got and it's all down to the technique that the surgeon's using. So it can all start off with alar base reduction, which is around the nostril area here. That can then also be incorporated into the different types of rhinoplasties too. And then you go into doing the full kind of bit of the nose. So you have a closed rhinoplasty, which is when a surgeon makes the incision sites going through your nostrils here.
Yeah.
For that, they can then do work to your bridge and a little bit of work to the tip as well. Then you have something called open rhinoplasty. And that's when the surgeon's doing work whereby they open up from under here. So there's a little incision site by your columella. I don't know if I ever pronounced that correctly.
So they open the nose fully then with that one.
They can lift it up. Sounds scary.
I know, that's mad, isn't it?
But then they've got a lot more kind of maneuverability to the bridge, to the tip. They can see a lot more as well, eh?
Do most surgeons do open?
Yes. And that's the thing. When there's one particular surgeon that does quite a bit of closed rhinoplasty, and he actually says that actually doing it from a closed approach technically should be the harder one to do.
Yeah.
Because then you're not able to see as much.
Yeah.
It's all down to how the surgeon does it. It's all down to their own preferences, how they work, the way that they learn how to do the rhinoplasty, and how they feel most comfortable and confident getting you the result that you want.
And it depends on skill set. Some surgeons will be better at doing, say, a closed procedure than another one. Yeah. Exactly. So it varies.
And then you also have something called septorhinoplasty, which is when the surgeon needs to manipulate the septum, which is the middle bone of your nose here.
All right.
So you could have it when you look up to the nose here, that septum could be slightly deviated.
Yeah.
So the patient may find that they can breathe better through one nostril to the other.
Yeah.
And that could be down to that septum deviation.
Yeah.
So I'd always explain it that septum is basically that middle port of like your TP. It's keeping everything nice and straight and in there.
Yeah.
So if that's deviated, that will then show on the outside.
Yeah. And sometimes you do get people as well that have the tip can look a bit sort of off, like the tip's just slightly to one side, and I always think that's nice when you can bring that back, so that it's
more
straight.
central, more straight, and just looking more refined as well. And you can then work with the surgeon if you'd rather have the nose straighter, if you'd rather it had more of a ski slope, if you wanted to lift up the tip. Again, for such a small area, there's so much that you can do.
A lot of people seem to be going for that sort of ski slope type nose, don't they?
It looks so pretty.
It does. It's very little.
Nice little petite. Cute little nose. Little button.
You wouldn't even notice it, would you? Some people, when they have it, you just look at it and you think, oh my God, that's so perfect.
It looks.
I do notice people's noses a lot, and I always think, oh, that looks nice.
And it'll always be with the rhinoplasty that it looks so much worse than it actually feels. So the patient's going to have quite a bit of bruising, swelling, like they've done a couple of rounds of Mike Tyson. However, how they actually feel is then, it doesn't really hurt. They can't breathe through their nose, granted, so their throat hurts a bit more. But within themselves, they feel fine. And that's that's actually quite nice to
Yeah.
then feel that way after quite a big surgery.
Yeah. How fast do you heal?
So,
You know, with all that, you know, when they do get that bruising, like they look like they've been fighting. How long does that take?
it's normally between like 7 to 14 days.
Okay.
And then they'll have their cast off, again, dependent on surgeon, between like 7 to 14 days too. And then you can start to see the big result, have the big reveal.
Yeah.
That's the most exciting thing.
Yeah.
It's absolutely
But
incredible.
a lot of surgeons say that it can take about 6 to 12 months really to get the final.
full, yeah. And I think with the rhinoplasty, it's the slowest healing area. So they need that full 12 months to then actually see how that result then goes.
Yeah.
Because for such a small area, you can have quite a bit of swelling. We've even seen it whereby patients, where they'd had the bridge removed, when the cast comes off, it can still like slightly be seen.
Yeah.
However, give it 2, 3, maybe 6 months post-operatively.
Yeah.
And then it goes. It's
Yeah.
incredible.
It's making me just want loads of things, this. I mean, I'm not exactly shy with surgery anyway, but it's making me like have a whole list
I could have
here.
a little tweak here, a little tweak there.
All these things that we want. Well, I think it's been interesting today just to chat about some of the things that we have spoken about, some of the different procedures, some of the ones that don't get the airtime.
Yeah.
Everyone's so busy talking about boobs. And I always think at MYA, we have very much been known as a boob brand.
Yeah.
But there's so much more to MYA. And we have so many other insanely good surgeons that do these beautiful results. And it's a shame just not to talk about those procedures. So I 100%. Hope that today we have allowed people to see all the other things that are possible here.
100%. And it's nice to talk about it a bit more so that people don't feel like they're alone as well.
Exactly.
So.
And there's a lot of people having these procedures, and some of the ones that we've touched on today, the ones that, you know, don't get spoken about very much. There are a lot of people having these procedures. They might not be shouting about it, but they are having them.
Yeah.
So please don't be shy, you know, and if anyone wants to come in and have a chat, we're always here.
And also head to the MYA forum as well, because that's a really good space where patients before, after are talking about these specific procedures too.
Yeah.
It isn't just boobs. You'll speak to like-minded people.
Exactly.
And know what to expect as well.
Yeah. And it gives people an insight into, you know, what their journey is going to be like at MYA.
Yeah.
You know, what other patients have experienced.
Yeah, their results.
Exactly. And that's always good to have a look at people's results.
100%.
I do love seeing results. When Esther, my sister, when she does the marketing material and we look at all the befores and afters.
It's amazing.
It's so good.
And I love it on the website, the little doo-doo, doo-doo.
Oh, yeah, where you slide it across.
It's so clever.
Yeah. So do take a look. But until next time, that's all from us today.
See you later. Thanks everyone for listening. Please hit the like and subscribe button.
And please follow us on all of our cosmetic surgery social media channels.
At MYA Cosmetic Surgery. You'll find us on TikTok at MYA Cosmetic Surgery. Share this episode with a friend and anyone that you think will love it.
Thanks, guys.
Bye.